And let's look at the autonomic nervous system. Your nervous system is big. Include the central nervous system, you have the brain, the spinal cord, you have the peripheral nervous system, you have the sensory part, you have the motor part. And the motor part can be divided into the somatic nervous system. This one, that's the motor neuron. And today we'll finish this part, that's the autonomic nervous system. It's not under your voluntary control. It can be divided into the sympathetic and parasympathetic. The autonomic nervous system have sympathetic and parasympathetic. They are like yin and yang, and they have different functions. Sympathetic, we call the fight or flight. That's when you see a bear coming towards you, your whole body are working together to increase your chance to survive, and that's sympathetic. And apparently your body could not stay in this state for 24 hours a day, 7 days a week. You need another system to balance it. That's parasympathetic. Parasympathetic is called rest and digest. That's when you kill the bear or successfully running away from the bear, and this system will be activated. So digestion is a big function of parasympathetic. Sympathetic and parasympathetic nervous system innervate your whole body. And sympathetic come from the thoracic and lumbar area. Parasympathetic come from the cervical and sacrum. They innervate your whole body. And sympathetic, their function is to increase your body to fight. So sympathetic system will dilate your pupil because you want to see clearly when you fight the bear. It will decrease your saliva production because that's part of the digestive function. It will activate your breathing rate, your heart rate, because both of them are going to bring oxygen to your body. It will inhibit digestive system and reproductive system because that's for long-term survival. And the parasympathetic will do the opposite. It will constrict the pupil, increase saliva, decrease this, and enhance this. So sympathetic, parasympathetic are like yin and yang. They have totally the opposite function, but they innervate the same organ. Structurally, autonomic nervous system have two neurons before they reach the target. We call this preganglia neuron. This one called the postganglia neuron. And of course, this synapse and this synapse, they're going to release neurotransmitter. Your adrenal gland stay above your kidney. That's adrenal gland. Adrenal gland can be divided into the adrenal cortex. That's the outside part. That's the steroid hormone, big steroid hormone source. That's totally endocrine. But today, let's look at the inside part. Inside part is called the adrenal medulla. It's a modified sympathetic ganglia. And when your sympathetic system is activated, one branch gonna go to the adrenal medulla, whereas adrenal medulla release catecholamine. Catecholamine is epinephrine, norepinephrine. And in adrenal medulla is mainly epinephrine. It's like 80% epinephrine, 20% norepinephrine. It will release to the blood, so we call it this neuron hormone because it's released by neuron and now it's carried by the blood. It's like a hormone. Its function is go to your whole body, make your whole body work together so you are able to survive. And let's look at the neurotransmitter. Sympathetic in the preganglia part release acetylcholine. It will bind with nicotinic acetylcholine receptor. The postganglia part release norepinephrine. It will bind with adrenergic receptor. The parasympathetic preganglia part release acetylcholine, still bind with nicotinic acetylcholine receptor. In the postganglia part, still release acetylcholine, but it binds with muscarinic acetylcholine receptor. So they have different receptors. In this slide, compare the somatic, only have one neuron reach the target, with sympathetic and parasympathetic. And this table compare both sympathetic, somatic, and autonomic nervous system. And this slide shows you the autonomic nervous system. Their cell body located in the lateral horn But the output, you only have the dorsal and ventral. You don't have a lateral output. So their output, their motor output, still goes through the ventral root and move out, the same as the motor neuron. It will reach the ganglia, from the ganglia reach the target. Let's look at the control center. Their control center is more than one. Most of them stay in the original brain area, the brainstem, like medulla oblongata and the pons. And another one is called the hypothalamus. Hypothalamus is a very important area for the control autonomic nervous system. And let's look at the nerve distribution. Sympathetic start from the thoracic to the lumbar. And let's look at the parasympathetic. Parasympathetic we call the cervical and the sacrum, so the beginning and the end. And the beginning part is actually including the cranial nerve. So cranial nerve 3, 7, 9, 10. These four are mainly parasympathetic, especially cranial nerve number 10, vagus. That's the output to go to control all your digestive system and also control your heart, slow down the heart rate. That's through the vagus. So that's the table, compare your sympathetic and parasympathetic. And the parasympathetic start from the cervical, actually it's not cervical, it's the cranial nerve, 3, 7, 9, 10, and the sacrum. So it will control your whole body. And its function is rest and digest. And that's the function of parasympathetic, because it's for long-term survival. And when you do yoga, you relax your body. What you do is you try to activate your parasympathetic nervous system so your body can recover, you can cool down. So that's the table, talk about the parasympathetic. Sympathetic start from the thoracic to lumbar. And they also innervate your whole body, but their function totally different. They're fight or flight. And when you feel like your life is in danger, you are driving, or we do the lie detector test, this also, it only detects your sympathetic function and your heart rate, your skin conductivity, your breathing rate. And that's why we need a person to analyze the data based on your sympathetic response, and this person analyze and decide you're telling the truth or you're lying. And this slide shows you the sympathetic ganglia. That's the outside of your, right next to your spinal cord. And this slide shows you your adrenal medulla. That's part of the modified sympathetic ganglia. The output starts from the lateral horn and goes through the ventral root. It will go through the ganglia, and from the ganglia move down to control your adrenal medulla, release 80% epinephrine, 20% norepinephrine. And these slides compare your sympathetic pathway with parasympathetic pathway. So parasympathetic release acetylcholine preganglia and acetylcholine postganglia. Sympathetic, it releases acetylcholine preganglia, norepinephrine postganglia. That's the main one. Your sweat gland, that's a specialized one. In the preganglia release acetylcholine, but the postganglia actually still release acetylcholine. It binds with muscarinic receptor. That's when you are nervous, you sweat a lot. That's this pathway. And that's the adrenal medulla. That's a specialized sympathetic ganglia. And this table compared the nicotinic acetylcholine receptor with muscarinic acetylcholine receptor. Nicotinic acetylcholine receptor is an ion channel, and the muscarinic is a G protein coupled receptor. And adrenergic receptor, we totally have 5, and I ask you to memorize 3 of them. The alpha is alpha 1. Beta 1 and beta 2. You find alpha 1 in the blood vessel. So when you're nervous, your blood vessel constriction is through alpha 1. When you constrict the blood vessel, your blood pressure increases. And the beta 1 is one in the heart. So when you are nervous, your heart rate increase, your contractility of the heart muscle increase. That's through the beta 1. And the beta 2, that's in the bronchial. So when you are fighting the bear, you need to have more air go into your lungs, so it will cause the bronchial dilation. That's through the beta 2. And there are some medicines totally mimic the function of autonomic nervous system. Like the beta blocker is actually the beta 1 antagonist. That's the one in the heart. And you decrease the beta 1 response in the heart, you decrease the blood pressure. So beta blocker is a hypertension medicine. And most of the organs, they have both innervation from sympathetic and parasympathetic. Like the heart, sympathetic nervous system will increase the heart rate, parasympathetic will decrease the heart rate. We call it antagonistic effects. And we talk about this term. In the muscle, we have the antagonist muscle, and they are working in the same joint, the update movement. And now we talk about the antagonistic effect, sympathetic, parasympathetic. They have totally the opposite function. But your blood vessel only have one. Your blood vessel only have the sympathetic. So the way they control blood vessel constriction dilation is they constrict it a little bit in the resting state. So if they want to constrict more, they increase the sympathetic tone so they can constrict the muscle, smooth muscle more. If they want to dilate the blood vessel, they actually will decrease the sympathetic tone so the blood vessel dilate. So they can use only the sympathetic to control the blood vessel. So we call the tone, the output, sympathetic tone, parasympathetic tone. And for example, you increase the parasympathetic tone, you will decrease the heart rate. And you increase the sympathetic tone, you will increase the vasoconstriction. That's it.